Hello, my name is Marc Laniado. I'm a consultant urologist. I specialise in helping men who have prostate problems, prostate cancer and prostate enlargement. I work in London and in East Berkshire. I'm an NHS consultant at Frimley Health Foundation Trust, and I work in private hospitals in the centre of London and in Windsor. I help men who have prostate problems return back to their normal condition. That is my specialty. Enhanced robotic surgery means taking steps to ensure that men have a good outcome, i.e. that they're cancer-free, and so that they're also dry and have good erections. Robotic surgery is keyhole surgery with computer assistance. It means you can treat the prostate cancer easily through small incisions and achieve good results consistently and well. Erection-sparing prostatectomy is a new way of removing the prostate that allows men to avoid urinary incontinence. The way it works is that we keep the bladder in its normal position. Typically, when the prostate is removed, the bladder has to be detached from its normal position. By keeping the bladder in its normal place, i.e. by doing the erection-sparing approach, bladder control and urinary incontinence can be avoided. NeuroSafe is the name for a technique which enables us to allow men to have erections after surgery better than we could do before. In the past, surgeons used to remove the nerves and blood vessels important for erections because it was not known at the time whether cancer was involved in that area, and we need to remove all the cancer usually. However, if we could know at the time of surgery whether cancer was present in that area, then we could avoid removing the nerves when we don't need to. So in this technique, we can test the prostate and the area around it in real time. If there is cancer present in those areas, then we can remove additional tissue. Hence, by doing this technique, we can intentionally preserve the nerves and blood vessels for erections without compromising on leaving cancer behind. For men with prostate cancer, the best way to keep good bladder control and erections is, in many cases, actually to avoid treatment, i.e. to go on to active surveillance, that is close monitoring with intervention later on if needed. However, if treatment is needed now, then if you can have focal therapy, which is just partial ablation of the abnormal area, that has a very good chance of keeping good bladder control and erections. And finally, if more significant treatment is needed, having robotic surgery with techniques that preserve erections and bladder control would be the best. It's possible to anticipate if urinary leakage is going to be a problem after surgery by looking at the size or the length of the circular muscle which stops urine from coming out of the bladder. That muscle is called the sphincter, and technically it's known as the membranous urethra. If you have a small or short sphincter, then you're much more likely to leak after surgery than if you have a long sphincter. Most men have quite a long sphincter, but a small portion have a short one. So if you're going to have surgery, it's helpful to know in advance how long your sphincter is. We'll discuss those aspects of your treatment in our consultation.